Hello, Care Team. I'm Dr. Marcus Sterling. As part of the CMS Guide model, we provide ad hoc one-to-one support calls. These are the unscheduled, informal conversations that happen when a caregiver calls you in distress or when you reach out for a quick check-in. It is easy to view these as simple chats, but make no mistake, these are clinical interventions disguised as conversation. When a caregiver is overwhelmed, this call is their lifeline. Your goal is to pivot the caregiver from survival mode to sustainability mode. To do this efficiently, we use the CMS GUIDE framework. Today, we are going to expand on this protocol with advanced strategies for handling resistance and deepening connection. The first phase is about grounding. You cannot influence a caregiver who feels invisible. C is for connect and compassion. The trap. Caregivers will often launch immediately into a list of the patient's symptoms. The technique, use a pattern interrupt. You must gently interrupt the flow of medical logistics to focus on the human being. The script. Mrs. Jones, I hear how difficult his behaviors have been today. We will address that, but I need to push pause for 1 second and ask, how are you holding up under all this pressure? M is for monitor and mindfulness. The science. Chronic stress causes dissociation. Caregivers literally stop feeling their own bodies. The technique. Act as a biological mirror. Connect their emotional tone to their physical state. The script. I can hear the tension in your voice. I want you to do a quick scan. Is your jaw clenched? Are your shoulders up to your ears? Let's take 5 seconds right now to just drop your shoulders. Breathe in and out. S is for strategize and solutions. The resistance. You suggest self-care. They say, I don't have time. The pivot. Stop suggesting macro self-care, like a vacation. Pivot to micro respite. The script. I know you can't leave the house, but do you have 5 minutes while he naps to sit on the porch without your phone? We aren't looking for a week in Hawaii. We are looking for a pause button. Once they are grounded, we move to action. The context. Under the CMS Guide model, we have specific benefits, like respite care. The technique, the warm handoff. Don't just give a website. Explain the relief. You are burning the candle at both ends. The guide program covers respite care specifically to prevent burnout. Let's look at getting an aid in for 4 hours next week so you can sleep. Shall I start that process?
Know you've been a good friend, and that's in the thick and thin.
The deep dive. You will encounter ambiguous loss, grieving the person who is still there. You will also hear resentment. The approach, normalize the shadow emotions. It is completely normal to feel resentful when you haven't slept in 3 days. That doesn't make you a bad caregiver. It makes you a tired human being. Let's give yourself some grace. The goal. Moving from abstract talk to concrete commitment. The technique. Implementation intentions. Get the when, where, and how. Okay, we agreed on that 10-minute coffee break. When exactly will you do that tomorrow? 8 a.m.? Great. Treat it like a doctor's appointment. It is non-negotiable. Finally, we look at the long game. D is for develop resilience. The reframing. Help them see that self-care is a strategy for survival, not indulgence. Resilience isn't about enduring pain. It's about recharging so you can keep going. What is your strategy for recharging this week? E is for empower and encourage. The closing. Restore their sense of agency. You are navigating a complex disease with incredible skill. But remember, you are the captain of the ship. If the captain goes down, the ship goes down. Taking care of yourself is the best way to take care of him. A final note on safety. During these calls, monitor for red flags. If a caregiver expresses hopelessness, rage fantasies, or neglect of their own critical medical needs, like missing insulin, this is no longer a self-care call. It is a crisis intervention. Follow your clinical protocols immediately. Master this framework. Use it. It changes lives. Thank you for the vital work you do.